Yep. Thank you indeed for this very great insight in what is happening in Moldova. And I think that is a great introduction for this roundtable that is entitled Involvement of Main Care Sector Stakeholders. And what we have decided that this actually will be concentrated on the organizational aspects and the direction of the European Commission towards comprehensive cancer centers. From that point, indeed, what you demonstrated in Moldova is already a step towards there. But just also to mention that those days, the official delegation of Moldova, including the Vice Prime Minister, are in Riga, and we did have a chance meeting them yesterday, and we are really very much interested in future collaboration to Latvia, to other EU countries, and also digitalization. So thanks for this introduction once more. And now I think we are coming back to the participants in the room. And just a couple of issues, housekeeping issues. You shouldn't really hurry too much for the lunch because it will be slightly delayed to really have this round table. Lunch will be starting at 12:15, so we do have some time. And I will start with the introduction of people in the room. And I will start with ladies. So Eva Melishus is a representative of the Ministry of Health. Vita Rovita is a principal investigator at the Biomedical Research and Study Center. Roland Slapuķe, whom you probably already know during those days, is the advisor to our state president. And Valds Ābols is the CEO of the Children's Hospital, as you pretty know. But last but not least, we do have a patient representatives, Eriks Mikkelsteins. And since I would give a very brief introduction, and then we would ask the patients really to start the discussion, and everybody of the participants is welcome really to see key points in respect to the aspect we are discussing. Also, the people in the room are invited, if you have really comments within this time frame, to come to microphones and to comment on this. So the topic and the key issue we are going to discuss is really the comprehensive cancer care in Europe and in each of the EU countries. As we know, according to the EU Beating Cancer Plan, each of the EU countries is supposed to have a comprehensive cancer center. And just to remind that it is excellence not only in clinical care, but also in research and education. So, and I would like to ask really the participants to comment their viewpoint on this, because actually for Latvia, if we are speaking in respect to the accreditation, we are very far from accrediting a comprehensive cancer center. We are in the phase of accrediting cancer center, and that is substantial difference. But actually each of the countries is required already by the year of 2025 to move ahead in this direction. So what are your comments? What are whether you see this as a possibility or vice versa, it is barriers that cannot be overcome. So Eric, please, the floor is yours.
Good morning. Good morning. I represent the Onco Alliance here in Latvia, which is the umbrella organization for all cancer groups, or a good number of cancer groups. We've come together under one umbrella organization that gives us more access to government and government people from a patient point of view, in patients wanting more access to personalized health care. Access to personalized medicine in Latvia needs to be improved. Access to drugs are uneven all across Europe. Many Latvian patients do expensive tests at their own out-of-pocket spending. And when they find out the results, that the medicines they need are either not available in Latvian, or if they are available, they're not compensated for. And these most often are the most expensive and leading edge medicines that are required. I'm sorry here. And these, after these tests, the tests are also not accessible to the patients. And all tests should be able to, a patient should have access to all these tests and be able to use them in future use for their own health care. And also all these tests need to be, come down to a centralized data bank or biobank where all people can access them in future for future use, not only doctors, but I could travel to a different country and my doctor in a new country could access this medical test that I've had done before to assess and improve my medical situation in the future. Gene sequencing is another issue that has come to light lately and Latvians don't have access to. These technologies need to be improved from all points. Doctors need more access to the latest technologies to improve competence in this field. The gene sequencing information should also end up in a biobank where they can be accessed in future analysis. And then finally in Latvia needs to improve the laboratory quality. There's no harmony in testing, no organized proficiency in testing, and no requirement for proficiency testing in laboratories across Latvia. These all need to come together. These test results cannot be hidden away in one particular laboratory and library. They also need to come back to a centralized place where doctors can have access and the patient has access to them. Thank you.
Thank you. I think you touched upon many different aspects, including also digital availability of all the data. And may I ask maybe Rolands to start, because really those are the aspects that have been debated quite a lot.
Yes, there's so much to say, and so I'll have a couple of remarks maybe that are not directly linked, but I was thinking Dennis Hogan gave us an overview and that we should be working all together. And in all that we've been doing with this European project DG Reform on the implementation of better cancer care in Latvia, we have a very good counseling by the EARC, and I was thinking, Dennis, there is something you did not mention in your presentation: the effect of war on the motivation, like we saw in Moldova, for the National Cancer Office to improve the multidisciplinary approach to cancer diagnostics. I think what I want to say here is a question of motivation. Jean-Claude Juncker said once, we know very well what to do, but we don't know how, as politicians, to be elected after we have done make those new decisions. That's where we are approximately. There are a lot of good ideas around, a lot of good possibilities. We are trying to go on the way that was presented today and yesterday on the way to digital or precision medicine, which means then that you have better data, better organized data, a good onco-register, good screening system, etc. And the problem is tactical, and the problem is how to achieve that when you don't have enough money and when you lack competencies, because competent people are very much involved in all kinds of processes, and they have to stop and find the time to think of the thing that Eric has been mentioning, because it is not that there is the impossibility of progressing, it's just that good people are very busy and they have to find time to implement those things. Valls will tell you about the processes in the digitalization of the children's hospital, which is one of the best examples of digitalization amongst the hospitals in Latvia. So these are very general remarks, but this is how I feel after what I have heard. We have to care about quality of data, about the flow of data, about the interconnections of all institutions, so that data that you are having in one place are being sent without, or they are present in other registers, etc. Complicated, very complex problem, and we need patience and systematic approach, do what we can do. One of the things that we are involved in is, for example, to have a good legislation on biobank and secondary use of health data. It's tremendously important, and I see that even that is not so easy. And within the European Union, there is a regulation coming from Brussels. The intentions are good, but they are relying also on national states, and the constatation is that it is quite fragmented, because at the national level you have different possibilities of solving this issue different solutions for legislation, which is depending on the local system. So it's not easy, and it's easy to criticize, but it's not easy to make relevant progress, I would say.
I think biobanking has been already mentioned twice, so I think that is the right time to invite Vita, because she's not only the PI at the Biomedical Center, but also behind the national node of the Latvian Biobank, and actually also behind the legislation in Latvia. And Vita, could you touch upon this, and maybe even broader, because you are representing a research organization that is not directly linked in the patient care, but how you see the place of research organizations in the overall structure of oncology care in Latvia?
Of course, as a research representative here, I must express that researchers are very interested in such well-working systems like cancer centers or comprehensive cancer centers, also for using the data that could be generated from such healthcare implementation ways to be used in research and furthering development of new therapies. But to also reflect on both opinions that were expressed here previously, there are many shortcomings or problems that we face that were already mentioned. But as I see that in Latvia, we currently have many initiatives that are working towards improvement. One is biobanking law, second is the secondary data use law that would provide specific instruments how to actually introduce many aspects of how both society and research could gain from already available resources, and maybe optimizing some of the resources that we have and improving them. Therefore, I see that we have a specific view where are we going in Latvia, but there are still many steps to go, and maybe also we need to work together and coordinate our activities on various levels, both on research, on healthcare, and policy introduction as well.
Thank you, and maybe right now it's time to come to the hospitals, and maybe the question to Valts, what was suggested by Vita, that maybe we have to squeeze to save a bit of money from wherever and invest it more into research. So how do you feel about this?
Well, actually, the presentations from Dennis and also from Thomas made me think a lot. And the questions posed in the last slide from Dennis regarding the barriers. And I would like step in my administrator's shoes, and I think about the input, process, and output. And I think what we're lacking currently is still the initial switch, which kind of triggers that process of input, process, and output. And that's a political will. I think that's something where we need very, very clearly to prioritize what we want to achieve. And that's something also kind of, it was reminded by Dennis' slide of Otto von Bismarck that I was tried to recall all the big reforms in healthcare, and they really started from very, very strong political will. And that's what's still to be achieved in our society here. That's number one. The other thing is, as I was thinking about last expression, what barriers? And here we have a problem. I remember somebody said, what's your problem? We have a lack of money. And he said, you do not have a problem, you just have a lack of money. In this case, I think we'd have both, because also from the slide of Thomas Hofmeister, what prevents the personalized medicine, or potentially the same goes for research. And we can solve some of the things quite instantly with the money. For example, the access to drugs. So we put in the money and we solve it instantly. But the third point and the fourth point, as I recall, was resources for genomic testing, and also the skills, continuous medical education, and the same goes for research. And that you cannot solve with an instant influx of money. That still will take some time. And that's really requires commitment. And we better start now, because we cannot solve these things with instant influx of money. And this should be really prioritization. I'm not sure that we can prioritize the resources from the hospital. The hospitals, and that's part of the problem, hospitals currently are funded just for the treatment function. There is zero funding, zero funding coming for research. And as we saw, I mean, concerning the precision medicine, I think research is absolutely essential part of how we act as a like player team, including the university hospitals. And yeah, from that perspective, I think well, that skill building, skill acquiring is a much bigger problem currently than just funding.
Thank you. Just to continue with the same issue on funding, it seems to me that Latvia is a bit of a country of contrasts, because what Eric has described, that indeed many patients do not have the access to medicine, maybe to diagnostics, to timely diagnostics as well. On the other hand, sometimes to me it seems that we are investing huge amount of money without any proper economical evaluation in other aspects that some countries that probably are not richer than Latvia, like Germany, would never have done without this. But I think we do have really a problem here, because definitely the budget is limited. At least that is what we hear from the Ministry of Finance. Ministry of Health is not getting all the funding that it is really asking for. On the other hand, how to decide on where to invest? Definitely all of this money could be spent in medication, no doubt about this, but in this situation we would leave, really, we will not have cancer registry, we will not have cancer screening. How to decide? And maybe Eva, I do not expect that you will give a proper and exact answer to this, but at least to raise a discussion on it.
Yes, thank you. Yes, what I wanted to, of course, I want to answer on all of your concerns, but I suppose I do not have a time for that. But what I want to mention, that actually we are moving forward, we are improving. Okay, of course we can do better. But yeah, there is a way, and we see it. And what I actually want to mention, that there is a plan of improving of healthcare services in oncologic field, which actually features a lot of measures. It's improving access of healthcare services in oncology, it's breast reconstruction, it's a reimbursement system of the medications. And actually, yes, like Professor Leija mentioned, that we have a main problem with the budget. And of course, if we have some kind of that percentage of GDPR in our health budget, then that's of course like a chain going in the health budget. I wanted to mention that in this year, we had this plan. We needed approximately 100 million, and we had almost 30%, so just 30 million. For the next year, we need approximately the same amount of the money, and of course we did it. We put it in the new politic initiatives. But you may know that now our Ministry of Cabinets and all the ministries are changing, and so new politicians will need to decide what will be that amount of money which will be given according to this plan. And of course, this plan is actually, yes, how I mentioned before, for the reimbursement system to reimburse more treatment possibilities. And for medication, it's approximately 60 million in that plan put it. And of course, it's one of what I wanted to mention, that it's diagnostic, molecular genetics and histochemical and that everything. It's approximately 6 million. But of course, it's new politicians decide how they will decide. And of course, we have a lot of legislation what we need to be done. And according what Professor Leija said about the cancer center, of course, we don't have now comprehensive center, and we need to move it to that. And now we are just starting to process this cancer center, which will be held above the Riga's Eastern University Hospital. And we need to put it now in the legislation, and it will be like a unified center with unified methodologies, multi-professional teams, and etc., etc. And the next step is, of course, research. But it's the plan depend on, of course, funding, time, and what is the most of important factors, human resources. So, thank you.
Thank you. Thank you. Those are really important aspects. And in the remaining couple of minutes, not more than this, just before we are concluding, I think that really we have very good cooperation to the Ministry of Health currently, but the issues are not really limited to the responsibilities of Ministry of Health. It is also, since research funding and research as such is concentrated at a different Ministry of Education and Science, and then also Ministry of Welfare, Ministry of Economy has to be involved. How to deal with this? And if we do not have questions from the floor, then I would challenge Rolands with this question and also ask him to conclude this roundtable.
I should thank the organizers of this conference, including myself then, because actually I've listened to a lot of very interesting things. And there was the presentation from Groningen, the Dutch system, where it started, if I understood correctly, regionally, and now there is a national system for all data. And I think this is exactly what we should be aiming at. So if there is one good news, Latvia is small enough to have one system without too much complications, and so we are able to do that. I was also very happy to hear that his colleague from Heidelberg was a bit envying what they were doing in the Netherlands. So other countries have also their problems. Each of us have different problems. And then I was listening to our Lithuanian colleague describing how they actually just, well, they started the process on molecular board developing, and they started it. So this is more or less what I'm taking. We have a lot of problems, yes, but it's not a problem, it's the lack of money or whatever. We can define whatever, we just have to do it. And I come back to this. I was in Moldova and he was in London. He explained what they have done with this tremendous amount of refugees coming from Ukraine that was not expected. No government can foresee that. And how they reacted, because he was the right person at the right position, certainly. But I know that he was in contact with Simon Oberst from the Organization of European Cancer Institutions, and in 8 conversations, Simon Oberst told me, they improved their capacity of doing what they are doing now with tremendous problems. It's not lack of money anymore. So this is, I come back to motivation, and you said that as well. The political issues, it's easier when you are motivated. So I think, thank you for this conference, because it gives an overview of a lot of good things to be done, and suddenly the fact that, yes, well, it depends on us actually, each of us here, sitting there, patients, research, excellent medical professor, director of hospitals, and the ministry, yes, maybe on myself as well. So thank you very much.
It seems that there's some final question or comment from the audience.
Hello, I just wanted to use opportunity and also actually to share experience from Riga Stradiņš University, who is also actually medical laboratory, also guiding and research institute. And this, I suppose, is one of, just want to stress for patient pain. It's like, it's not so bad in Latvia. Actually, yesterday it also was presenting from Children's University Hospital clinical lab showing growing experience and also access and interpretation and skills in genetic testing, and also that for sure is good experience and showing that we are going in Latvia. What I wanted to also probably comment, we were seeing also today experience from Sweden, large country, but still when they are talking at tumor boards, actually it's combining from multiple medical institutions. And so probably idea for Latvia that we are so many experts as we are. We know very well that we are probably sharing our employment places, but probably when coming to patient needs and for availability for diagnostic testing and interpretation, probably we can share our experience between medical institutions. So that would be also, we are living in Zoom era and so on, so it's accessible, and probably it would be better communication and also growing for more excellent also those services, medical services. So.
Thank you for the comment, and that was really important to demonstrate also the good things, not only the limitations what we do have. But with this, then I would suggest that we are wrapping up and having a nice dinner and coming lunch, sorry, and coming back on time for the next session. Thank you.